There is a dire need for investment in community awareness to reduce the burden of premature births in the country.
The prematurity itself varies. It depends on the gestation that this baby was born and the weight of the baby that was there. So there are various difficulties depending on the weight and the gestation level.
In Kenya, 193,000 babies are born before 37 weeks of pregnancy are completed, making 1 in every 8 children born in the country premature.
We have managed babies with up to 28 weeks of gestation, with as low as 750 grams, becoming term and becoming post-maturity term and actually being able to make.
We visited Mama Lucy Kibaki Hospital. Dr. Abdinasir Isaac shares that they handle over 200 deliveries monthly with around 100 babies born prematurely.
This is June, isn't it? For May, we had a total of 210 admissions, and out of the 200 admissions, 100 were preterm babies. So you can see the numbers.
Unfortunately, approximately 14,000 premature babies lose their lives due to various health complications. The World Health Organization notes that kangaroo mother care, where the infant is held skin to skin on the mother's chest, can prevent most of these deaths.
We are recently carrying out a training on preterm survival rate in Africa in collaboration with Indiana University, Aga Khan University and Jomo Kenyatta University to look at how to address the issues that are leading to stagnation, where in Kenya, 20 out of 20 babies born, out of 1,000 babies born, 20 die. As a result of that, Mama Lucy Kibaki has started Help a Baby Breathe Center.
We put the mother in a kangaroo mother care, or we put the baby in a kangaroo mother care. We also advise the fathers when they go home, they can continue that services and the baby can stay there, the mother can work, the baby can get weight enough, gain weight very fast, more than the incubator, and they go home.
While the cause of about half of preterm births is unknown, Dr. Abdi tells us that from the data they collect, poor nutrition, alcohol intake, smoking and chronic diseases are the major contributors to preterm births.
If also the mother is an elderly mother, that's the pregnancy, then she's an elderly mother, also it can cause a premature labor. There are some other conditions like the incompetence of the cervix. If the mother has cervical incompetence, also it can have prematurity labor. The other abnormalities according to the fetal abnormalities, like if the fetal has some congenital abnormalities.
At Mama Lucy, we met Vivian Chepkoech. On the 3rd of March, she gave birth to her daughter, who weighed 750 grams only.
Nikitoka nursery alikuwa na kilo 1375. Kukuja hapa, nika gain from there hadi 2 kg. Nilikuwa nimetravel from Nakuru to Nairobi. So that was the first challenge. Kitu ingine ni about food. Sikuwa na appetite. Kitu ingine ni ile kuinama for so long.
The situation is not different for Grace Mudhoni, who gave birth to twins, weighing 1.3 kilograms and 1.4 respectively.
Kwenda safari na kukule poa hivyo.
Before a preterm baby is released from hospital, it takes processes of stabilization, incubator care, and any further procedures depending on the state of health of the child.
What we normally do is actually we instruct them on how to feed. These preterms are very small babies, and when they're small, they're not able to suck the breast well. So we feed them through the nasogastric tube, instruct the mother how to feed, calculate for them the daily requirement that the baby requires, and monitor them throughout their stay until they gain their weight.
To this end, early and consistent antenatal clinics, access to quality healthcare, nutritional support and health education are essential to improving outcomes for premature babies and reducing the burden on families and the healthcare system.
They are actually screened for any diseases that are there, so that if other diseases like the tortious diseases, the malaria, toxoplasmosis, all these can cause a preterm labor. So they are screened early. So when they are screened early, they are able to get treatment and they are able to keep their pregnancy.
More than 190,000 babies are born preterm in the country, with at least 19,000 babies dying from complications that are related to preterm births. It is the responsibility of a mother to take care of their child during pregnancy to enable the child to be healthy and live a long and healthy life. Robbie Omondi, K24, Nairobi.